Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. This is your weekly minisode where we'll provide a brief update on local public health news. So, Tom, what's up in public health this week?
Today, we have Dr. Rachel Herlihy, Deputy Chief Medical Officer at the Colorado Department of Health and Environment, here to talk about measles. Dr. Herlihy, thank you so much for joining us. Before we get to today's topic and discuss measles, would you mind telling us a little bit about yourself and how you got started working in public health?
Sure. Well, first of all, thank you so much for having me. I'm excited to be here and have a chance to talk about public health and measles. So I am a preventive medicine trained physician and actually had a very long-standing interest in public health that first started in high school when I read a book called And the Band Played On, which is a book about the HIV epidemic, also a movie if you don't want to commit yourself to reading a full book. And it's the story of the HIV epidemic and the epidemiology, the policy, and I found it very fascinating and decided at that time that a career in epidemiology was something that was of interest to me. So made my way through college and medical school and then a master's degree in public health.
Can you tell us about what measles is and how it is transmitted?
Yes. So measles is a highly contagious respiratory viral disease. So when you think about what type of virus measles is, it's actually a respiratory virus. So that means that it's similar to other respiratory viruses that we think of, like the flu and COVID, and spread in similar ways in respiratory droplets and aerosols. So spread when people are just breathing, coughing, sneezing. You can get the virus from an infected person from being in proximity to them if they are coughing. You can also touch surfaces that might be contaminated. And then one really unique thing about measles, which is part of what makes it so infectious, is that the virus can spread in these very small droplets or aerosols, we call them, that are these tiny particulates that can stay in the air, floating in the air for an extended period of time. We say up to 2 hours, meaning that if you are in a room that a measles case was in 2 hours before, you can still get exposed to the virus. So again, highly contagious, very easily spread from person to person. In fact, it's the most contagious virus that we know of.
So what are some common symptoms that someone experiences when they do have measles?
Yes. So when we think of measles, we all think of the measles rash, but measles actually starts off like any other respiratory illness, and that folks will have a cough, runny nose. Common with measles is going to be conjunctivitis or eye irritation, like pink eye, and then fever. And individuals tend to have a pretty high fever when it comes to a measles infection compared to other infections. And then typically after those respiratory symptoms start, about 3 to 5 days later is when that telltale rash starts. And the rash typically starts on the forehead and the face, and then spreads down the body. In fact, we sometimes describe it as a bucket of measles, or having sort of like a bucket of red paint poured over your head, where you have this initial concentration of the virus kind of at the top of your head, and then the concentration of the rash at the top of your head. And then as you move down your body, there's a less of a concentration of the rash.
Very interesting. So how concerning is measles?
Yeah, I think it's important to note that measles is really not just a rash or not just a respiratory infection. In fact, it can cause lifelong problems, things like hearing loss and brain damage. And if you look at the most recent data from 2025, it put 11% of infected people in the hospital. So this is a serious infection. It can cause complications like pneumonia. That's one of the most common complications. Also, ear infections are going to be common. And then you can also see much more severe consequences, including brain swelling or inflammation known as encephalitis. And then there's other problems that it causes, including something called immune amnesia, where infection with this virus can actually basically wipe out your immune protection from other infections you've had previously, so that you're no longer protected against other viruses you've previously had. And then I would say probably the most tragic and severe consequence of measles infection is going to be something that's a devastating neurologic condition called subacute sclerosing panencephalitis. That's a long-term SSPE. And that's a condition that thankfully is not common. So it's one in several thousand individuals who develop measles will develop that, and more common in very young infants that develop measles. But it's a progressive neurologic infection that is ultimately fatal and occurs several years after a measles case. So isn't something that occurs right away. It occurs years after that measles infection. So many reasons that we want to prevent measles infections from occurring in the first place, and why measles vaccination is so important, and why our efforts in public health to control transmission and contain cases when they occur is so important.
Is there a specific segment of the population that is at higher risk when it comes to measles?
Anyone who is unvaccinated is going to be at risk for measles because the vaccine is so highly effective. We say 97% effective after 2 doses of the vaccine, that the vaccine offers very good protection to anyone that has received it. But I think it's important to note that babies don't receive this vaccine until typically at least 12 months of age. So really anyone under 1 year of age is going to be susceptible to measles infection. There are some infants that might get the vaccine a little bit early because of exposure risk or international travel, but for the most part, infants are going to be at risk. And infants are really going to be a population that is at higher risk for complications of the infection. And then really anyone over the age of 20 that's unvaccinated and develops the infection also has higher risk of developing complications from the infection. So it's really those two groups. It's infants, and then really anyone over the age of 20 is where we see that higher risk. And then of course there's always going to be individuals who are immunocompromised that will have a harder time dealing with an infection, including a measles infection.
So if someone does, test positive for measles, do they have to quarantine?
There's a term we used called isolation. There's another term, quarantine. And then sometimes we just ask people to stay out of school or stay home for a period of time. And so we can talk through all of those. So the term isolation is the term that we use when someone has an infection. So when they're actively infected with a disease, whether that's measles or something else, and we ask that person to stay home while they are ill so that they don't go on to spread that infection to other people. Quarantine is actually a term that we use for individuals who have been exposed to an infection, so had an exposure to measles, but haven't yet developed any symptoms, but we know because of their exposure that they're at high risk of developing the infection. And so because of that, we want them to stay home so that there's not risk for them spreading the infection to others while we're waiting to see if they're going to develop an infection or not. And then individuals during outbreaks in school settings, we also ask unvaccinated students and staff to stay home during that outbreak because they're at high risk of infection and perpetuating the outbreak in a school setting.
Thank you for making that distinction. Can you give us an update on the current measles situation here in Colorado?
Yes. So at this point, there is a measles outbreak that is occurring in Broomfield County that is associated with Broomfield High School and Broomfield Heights Middle School. It involves students that live both in Broomfield, but also in surrounding counties. So far, there have been 10 cases associated with that outbreak. And some of them are in high school students. Some of them have been in middle school students. One case has occurred in an adult who was a household contact to a student. So that's a total of 10 cases associated with that outbreak. In addition to those 10 cases, we've had 2 other measles cases in the state in 2026, including one that we just recently announced this week. And those 2 cases that we would consider sporadic cases are not connected to this outbreak. They're both in individuals that had traveled out of state for some period of time. And we believe in both of those situations that they were exposed out of state.
Are there other detection mechanisms that CDPHE is using, like wastewater surveillance, to kind of keep an eye on measles?
We are doing wastewater surveillance. We do have, and you can check this out on our website, we do have a wastewater surveillance program in Colorado that looks at multiple pathogens. So we are tracking COVID and influenza, RSV virus, also tracking measles, of course. And so that data is available on our dashboard where you can look at the locations around the state that where we are doing this wastewater surveillance. And at times during outbreaks, we do also turn on these specific sites that are kind of extra emergency sites for us to help us understand if there's measles transmission in a particular community that might be happening. And so we are relying on wastewater surveillance in addition to our routine surveillance to identify spread. I will say, though, that we are still very much in the learning phase when it comes to wastewater surveillance. We have a lot of experience now with tracking respiratory viruses like COVID-19 and have a clearer understanding of how to interpret that data. With measles, this is really only something that we've been doing in Colorado and even nationally for a few months now. And so we're really still trying to understand how to interpret and use that data to help us know how much the virus is spreading. And as you can imagine, measles is very different from COVID-19. When you think about COVID and you think about people that are ill, there's going to be lots of individuals in the community that are sick at one time versus measles, the number of cases is much smaller. And so our ability to detect the virus in such a small number of people can be more challenging. So again, I'm still really working out how to use wastewater surveillance for measles, but excited about the prospects going forward.
Interesting. So once a positive case has been confirmed, what happens next? What does the response look like?
Yeah, so the first thing we want to do is public health, and whether that's us at the state health department or more likely our local public health partners are going to reach out to that case and interview that case to try and figure out where that case may have been exposed. So sometimes we have known exposures and sometimes we have unknown exposures. We might not know where an individual may have been exposed to the virus. And that was actually the situation with the initial cases in this Broomfield outbreak. We really weren't certain who they were exposed to. And then the other really important thing that we want to do is identify people that they may have been in contact with so that we can ensure that those individuals are aware of their exposure. We can identify whether or not they are immune to measles, so whether or not they've received the vaccine or not, or had a prior infection or have documentation of a laboratory test that says they're immune to measles, because that helps us understand who might be susceptible to going on to develop infection. And again, going back to that quarantine idea and asking folks to stay home if they're not immune to measles is a really important strategy to prevent that next generation of cases from occurring and additional spread from occurring. And so that's a really important part of what we do through those case interviews. And then also for measles, there's something called post-exposure prophylaxis. And this is the term that refers to giving medication or a vaccine to a person who's been exposed to an infection to try and prevent them from going on and developing that infection. For measles, it's a really tight window. So after an exposure, we have about 72 hours to get a dose of the MMR vaccine to a person to prevent them from going on to develop measles infection. It's a pretty small window, and that's tough to do when you think about the timing of someone developing symptoms, getting tested, that result getting reported to public health. For higher risk individuals, there's also immune globulin, which is preformed antibodies that we can give to people if they're at high risk of developing severe measles. And that window is a little bit longer. That goes out to a week. So we have a little bit more time to get immune globulin to people for post-exposure prophylaxis if needed. So that's a really important part of what we're doing when we're interviewing those cases and trying to find their susceptible contacts. And of course, then with the case that we're interviewing, we're asking them to stay home so that they don't expose others. And for measles, and it's going to be different for every disease, that period of time you need to stay home. But for measles, the period of time when you're infectious is typically 4 days before your rash starts until 4 days after your rash. So we ask people to stay home from from the time they develop the rash, which generally people know that date, for an additional 4 days. And then after that, they can come out of that isolation period. We also ask that people, if they do need to seek healthcare, we want to make sure that people are seeking healthcare if they need it, but they call ahead, call their healthcare provider ahead of time so that if they need healthcare, they can make arrangements at the clinic or urgent care emergency department to make sure that other people aren't exposed when that case comes in to receive healthcare.
So that leads to my next question. How is measles treated?
Yeah, so there's unfortunately not an antiviral medication that we can use to treat measles. It's really just going to be supportive care to ease symptoms. And so that's going to include rest, hydration, fever reducing medications. For some cases, particularly in children that are hospitalized, there is a recommendation for vitamin A supplementation to be given. There's some evidence that vitamin A supplementation, especially when there's vitamin A deficiencies, can decrease the rate of measles complications. But I think it's important to note that vitamin A cannot prevent measles infections. What vitamin A does is decreases the potential severity of a measles infection after it has occurred. The most important thing and the most effective thing is going to be protecting yourself through vaccination. So 2 doses of the MMR vaccine are 97% effective at preventing measles. So most kids, we do have records in our state immunization registry. Those records are available to know whether children have received vaccines or not. For adults, not every adult has their vaccine records and has certainty about whether or not they've received doses of MMR vaccination. And so certainly important for certain higher risk adults to make sure that they're protected. And that's going to be, people like healthcare workers should really have 2 doses or evidence of immunity to measles. People that are traveling internationally, absolute, or to outbreak areas certainly want to make sure that they're protected against the measles virus. And then also people that are in higher education, living in dorms, residential settings, really important for them to be protected as well. Um, Otherwise, certainly making sure that kids are up to date is a really important strategy. Typically, the first dose of the MMR vaccine is given between 12 and 15 months of age, and then a second dose at 4 to 6 years of age. And it's really after those 2 doses that we see this very high level of protection of 97%.
Where can people go to learn more about measles and find the most up-to-date information concerning an outbreak?
Yes. So our website, so CDPHE's website has a dedicated page for measles, and you can find information about ongoing cases in Colorado, outbreak information about the cases we've had by age groups, the counties where we've had cases, whether cases have been hospitalized or not, that type of information. And then also on our website is information about exposure locations. So when we identify measles cases and we do these case interviews, we ask where people have been in the community and post those locations to our website so we can notify the public that they had a potential exposure to measles if they've been in one of these locations.
Is there anything in particular you wish more people knew about measles?
I think it's important for people to recognize that measles is not a mild rash infection, that it's a severe disease and has severe consequences, including things like pneumonia or long-term hearing loss, lots of significant consequences. But of course, the good news is that it's highly preventable, highly effective, safe vaccine that can really prevent the infection and, of course, prevent those severe complications as well.
I would imagine there's quite a bit of mis and disinformation about measles at this point. How has that been a barrier to some of your work in public health?
Yeah, that is a challenge. And our priority is to make sure that Coloradans have the information that they need to make choices for themselves, right? To have access to information about measles infections and the severity of measles infections and information about the safety and effectiveness of the MMR vaccine. And so that's really going to be our priority. We have seen declining vaccination rates in Colorado and around the country over the last few years, and that is certainly a challenge, and probably has, certainly not helped with the situations we're seeing around the country right now with the number of measles outbreaks that are happening. The cases that we're seeing in Colorado and in the US are numbers of measles cases that we haven't seen since the 90s. So this experience we're having right now is really challenging and can be frustrating at times too, because we know that these infections and the complications that they're causing are preventable.
Can you talk about how the approach to measles prevention has changed over time?
We now have a much more effective and much safer route for patients, parents, children to take to gain immunity than what was experienced through actually acquiring the infection and risking those complications.
Well, Dr. Rachel Herlihy, thank you so much for your time. We really do appreciate you taking the time to speak with us today.
Thank you. I really appreciate your time as well.
Next, we're joined by Beth Seymour, Managing Director of ACT Human Rights Film Festival, here to talk about this year's event. Beth, thank you so much for joining.
Thank you so much for having me.
To start, can you just explain what the ACT Human Rights Film Festival is?
The ACT Human Rights Film Festival is a program of Colorado State University, and it is one of 3 human rights themed film festivals in North America. One's in Atlanta, one's in California, and we are the only one in between. We are a professional film festival, so we show films from around the world, and it's a curated slate. We bring in filmmakers, we have conversations, we have parties, panels, events. It is a 4-day festival this year from April 9th to 12th, and we're really excited about this year's lineup.
Awesome. How many films are on the schedule this year?
This year we're presenting 28 films from 13 countries across 5 continents.
What's the process for selecting films for the festival?
So our process starts in late summer, where we begin gathering film titles that look appealing from film festivals around the world. So we look at other festivals near and far to see what human rights titles they're playing. We also have an open submissions window in the fall. All in all, we gather about 200 films to review, and we have a committee of about 30 people who watch films. We try to get at least 2 people watching every single film that we consider, and then from there, we work really hard to put together a diverse slate in terms of geography, in terms of topics, in terms of what stories are being told, not just within one festival, but also year to year. So that we're really putting together a time capsule of important human rights issues from any given year. And I will say that artistic excellence and looking at the film's quality technically as well as artistically is also part of what we consider. So it is an education program of the Department of Communication Studies where film studies lives. So it's equally looking at the topics, the issues, as well as how the film's being put together and pushing cinema forward.
Are there any films that you're personally excited about this year?
This year's slate, I will say I'm excited about pretty much every film, and it's always hard to pick favorites. One film that we chose more than a month ago and is sadly more relevant now than it was a month ago is Do You Love Me?, which is a portrait of Beirut from Lebanon. And the filmmaker took tens of thousands of archival sources and pulled them together to make basically a cityscape used entirely of our archival footage of what the history of Beirut is. And it's an absolutely beautiful film and impactful and really just interesting. So I'm excited about Do You Love Me? Our opening night film, Comparsa, is devastatingly beautiful and inspiring, ultimately hopeful. And our closing night film is coming to us from Sundance Film Festival, where it won the U.S. Documentary Award as well as the Audience Favorite Award. And it's called American Pachuco, The Legend of Luis Valdez. And the filmmaker will be joining us on Zoom for that. We also have filmmakers for Comparsa for opening night coming, as well as a film participant from Guatemala flying up.
So it sounds like in addition to screenings, there's discussions with the directors and filmmakers.
Yes, we prioritize having time to talk through issues, to talk through the film. So we try to invite as many filmmakers as possible to join us. And when filmmakers are unavailable, we often invite subject experts to come and help community learn more about the topic in the film, learn more about what they can do. moving forward.
How did the ACT Human Rights Film Festival get started?
A film professor at Colorado State University, Dr. Scott Diffriant, received a Morgan Endowed Chair Award where he was given funds to research human rights film festivals around the world. So most countries, or many countries, have human rights film festivals. I know of at least 60. They're very common in Europe, less so obviously in the United States. And there are definitely film festivals throughout Africa, throughout Latin America, and Asia as well. So he traveled the world studying these human rights film festivals and still had enough money to seed the first ACT Human Rights Film Festival. That was in 2016. And the event went so well that our department, the Department of Communication Studies, decided to keep the program going. So we're now in our 11th year with more than 27,000 people having attended, more than 300 films having been screened, and more than 150 directors or filmmakers joining us in person.
You mentioned human rights film festivals throughout the world. I saw that the ACT Film Festival is part of the Human Rights Film Network. What does that mean for the ACT Human Rights Film Festival?
The Human Rights Film Network is based in Prague, and it is a network of human rights film festivals, and we communicate regularly. We share film titles, we share professional development, we support one another. Most recently, I juried the film festival in Jordan, out of Amman, Jordan. I get to watch Jordanian short films, which was a magical experience. I've also had the opportunity to travel to Kathmandu, Nepal in person and be a jury member there. And I also had the opportunity to jury Movies That Matter in The Hague in the Netherlands. So we support one another in a variety of different ways. Our colleagues in Jordan helped recommend and identify films from the Swana region for this year's festival. So we lean on one another's expertise for what films are really pertinent geographically, based on the people who live in those regions as well.
How has the ACT Film Festival changed since its inception in 2016?
So I would say our core mission has remained the same. We are still a human rights film festival, and our priority is uplifting the art of cinema and showcasing films that explore human rights issues. Each year, the festival is a little different. Some years we have poetry readings. Some years we have art exhibitions. Some years we have music. It's truly an immersive festival experience. This year, we have a workshop from our community partners out of Isaac looking at building community safety plans. And the registration for that is limited. So if folks are interested in community safety plan building alongside Isaac, please do sign up for that.
The film festival highlights a variety of important topics. Are there suggested next steps for attendees who maybe feel moved by a film and want to get involved with the topic or the cause that it captures?
Our film festival brings community partners, nonprofit organizations to the festival for every single film so that audience members can learn about community work happening here in Larimer County and how they can get involved, whether that's volunteerism, advocacy, philanthropy, or just learning more about a topic. So we bring community experts and advocates, nonprofit leaders, and community really enjoys connecting with them. And the community nonprofits have reported they've gotten, board members, volunteers, donations from these partnerships. So it really is a mutually beneficial partnership to work with community organizations and strengthen our civic sector through that.
That leads directly to my next question. How have you seen the film festival impact Larimer County here locally?
So that is a difficult question because when you're looking at measuring the impact of the arts, one would need to do, a survey before the audience arrives on the topic, an immediate exit survey, a survey a week later, a survey 3 weeks later, a survey 6 months later to see, did your attitude or behavior change and did you sustain that change in behavior? So we've never done that. However, anecdotally, people will tell me regularly, when I read a news story on, we'll say Iran, I think about that film and I think about the people in that film and I think about their stories and their lives, and it becomes real. It's not just people over there, they're people. So it really does create bridges for audience members to see the world and to see humanity more holistically and step into other people's shoes. I regularly hear from our audience members, I still think about that all the time.
We know that social connection and a sense of belonging and community lead to better health outcomes. How does a festival like this help foster that sense of community and belonging?
So this year's festival really leans into the power of art. our opening night film as well as our closing night film show communities that have scarce resources and still lean into creation and community building through the arts, through performance, through festivals, through costumes. And through these processes of creating art together, the film participants build community and heal and build a sense of belonging and are seen and feel seen, and their stories are being told. We see that reflected back within our own audiences when people see their stories or faces that look similar to them on screen and feel heard, feel seen, and feel validated in their stories. And it is an important opportunity to just really, in a very safe, easy space, learn about other people's experiences.
What makes this work feel important for you personally?
I feel incredibly honored to have the opportunity to do this work. I get to watch the audience watch films, and my favorite moment is when the credits start and I can see exactly how a film has affected an audience, and whether they're sitting absolutely still thinking or whether they want to turn to their neighbor and instantly talk about the film. I can watch the effect and the impact that film had. I especially love watching CSU students watch films because often it's somewhat of a brand new experience for them. Most of them haven't been to a film festival, and the genre of film we show is not necessarily something they've had a lot of exposure to. And so students get really inspired and will tell me they want to become documentary filmmakers, that they want to do this work forever, or they want to pursue a career similar to something they saw in the film. So it's really fun to watch how inspired people are by films.
Is there a film screened during the festival's history that's had a particular impact on you?
I will mention two films that have had a tremendous impact on how I walk through the world. I actually love films that really challenge me to think harder, think better, do better. One of those films we screened last year, it was Reed Davenport's Life After, and it was about people with disabilities and the right to die movement. And Reed Davenport's a brilliant filmmaker, and he started the film with sort of the news clip of how you would see the issue of, should people with disabilities have the right to decide whether to end their life or not? And he started with a very simplistic sort of, quick news clip of that. And then he started unraveling that and telling human stories. And I realized how often we take our news clips and we don't dig deeper to understand more, and how I had been somewhat remiss in accepting the simple answer, accepting sort of, the party line or the political answer for issues, and that I really needed to continually learn and dig deeper and learn more about issues. Another film that we showed a few years ago, and I will say we've never had as much, contention from audience members who typically support our festival over any programming choice, but we got a lot of pushback. And then we also got a lot of applause after people had seen the film. But the film we showed was called Your Fat Friend, which was about podcaster and celebrity author Aubrey Gordon. And she is at the forefront of the fat rights movement, which is what she calls it. And audience members in Fort Collins and Larimer County would say this isn't a human rights issue, but of course it's a human rights issue. How we treat our neighbors, how we treat people is absolutely a human rights issue. And when the audience saw the film, most people told me that they'll walk through the world thinking a little kinder, a little more compassionately for their neighbors. So that was an important film to show as well.
If listeners would like to support the ACT Human Rights Film Festival, is there a way they can donate or get involved?
Yes, we are currently running a matching donation campaign through the end of March. So every dollar donated right now will be matched by our generous funders. You can go online to our website, actfilmfest.org, to learn how to donate. We also need volunteers. Our volunteer email list sign up is also on our website, and you'll look at the tab at the top, Get Involved, and sign up to get our volunteer email so that you know when volunteer shifts open up, which should be in the next couple of weeks.
And tickets for this year's ACT Film Festival are on sale now. Where can listeners go to buy tickets and see the full festival schedule?
Tickets and our full festival schedule are available online now on our website at actfilmfest.org. All tickets are $0 or more, pay what you can tickets, to ensure that anyone in the community can attend our film festival.
Awesome. Beth, thank you so much for joining us.
Thank you so much for having me.
Do you have a question about public health in Larimer County? or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org.
Until next week, stay well, stay connected, and remember, we really are healthier together.